So we have a session this afternoon on tobacco control and the importance of moving towards a smoke-free society in the UK and in other countries. And the main reason why we're doing that at this conference is because tobacco is still responsible for 1 in 4 cancer deaths and 1 in 5 cases of cancer in the UK. And it's the most preventable cause of cancer. And what we tend to find is that people have a good understanding of the links between tobacco and some forms of cancer, like lung cancer, for example. But there's still a general lack of understanding, and not only amongst the public, but even amongst clinicians, other professionals, about the links between other types of cancer and smoking. So we know that the smoking is directly linked to over a dozen forms of cancer. So the session really is thinking about looking forward and asking, what have we achieved? So smoking rates in the UK have reduced significantly. They've reduced by half really since the 1970s, but we've still got 1 in 5 adults in the UK who smoke. There's 10 million smokers, and we know that about 200,000 young people start smoking every year still in the UK. So it's not something that we've tackled. So the session really looks at 4 things. It looks at where we are in relation to smoking rates and who smokes, because smoking is increasingly concentrated in more disadvantaged groups in society, and those are the groups we need to target and work with. It then looks at the international context for where the UK is. So we've got a colleague, Professor Jeff Fong from the University of Waterloo in Ontario in Canada, who's come across to talk about the International Tobacco Control Survey, which compares where the UK is in relation to other countries. And we've done some things well, and we've done other things not so well. We have 4 countries in the world now that have set targets for tobacco-free society, and that really means 5% or less smoking prevalence. Scotland's done that. Our government has said that we aim for that by 2034, and Ireland have just come out with their own plan. We don't have one for England and Wales yet in terms of a target, or Northern Ireland, but Cancer Research UK and others are working with UK governments to try and persuade them for the need for that. I think targets are useful because they focus the mind, and they encourage us to think about evidence-based interventions, which is what those of us in the research community are interested in promoting in relation to tackling smoking. So we're still hopeful on the plain packaging front. The Scottish Government is committed to introducing it if Westminster doesn't, but the UK Government are now looking again at it. We hoped that they would make a commitment to it already, but they haven't. We've now got an amendment to the Children and Families Bill in the House of Lords that's going through. But we did a systematic review at the University of Stirling a number of years ago for the Department of Health, and we've also done work for Cancer Research UK on this, looking at all the evidence around standardised or plain packaging. And essentially it would do 3 things. It reduces the appeal or the attractiveness of smoking and the pack, because the pack is really the only remaining form of tobacco advertising. It also takes away from the confusion that smokers have about the harm from cigarettes, because most smokers believe that not all cigarettes are the same, and the pack can convey less risk, like lighter cigarettes, for example. And also, if you remove the branding and the imaging from the tobacco pack, you make those visual health warnings, the picture of a diseased lung or a baby in an incubator, much more salient. And we've done experimental research with smokers which shows that they pay much more attention to those visual health warnings if it's a plain pack. So that's why it's a policy that we think is evidence-based, and we hope the government will move forward with it. Political will is a big issue. I think you can have all the evidence in the world conducted by rigorous studies, good quality research teams, but unless the government is willing to take action, we're in a difficult place. So that's the first thing. But I think the second thing is that we have to focus the minds of organisations that are doing research on cancer and others towards prevention. If you look at the broad spectrum of research in this area, for example, on cancer, you see that most resources are directed towards treatment, whereas actually we could achieve much more if we could stop people from developing cancer in the first place. And that's really what our session is all about. The bottom line is really that we're dealing with a huge, powerful, multinational set of organisations, the tobacco industry, which is often called the vector of smoking-related diseases. And their ability to lobby government, whether it's at UK level, you may be aware of some of the recent media coverage on that, or also at European Union level, which is very important for UK tobacco policy. So you've got vested, powerful corporate interests who really are interested in continuing to sell a product that kills. So we need political will, but we also need a government that's willing to recognise that the needs of the public and public health are more important than the needs of those corporations. And we don't currently at the moment, perhaps, that's not the place that we're in. I think you have some countries that are quite courageous. Finland, for example, New Zealand are looking much more, but really ambitious. New Zealand, for example, is looking at making tobacco unavailable for sale in the country. Or phasing it out. So there's those kinds of policies which are really quite dramatic and would actually achieve real change. On the treatment side as well, I think there are many countries, the UK has actually not been bad on this front, where we can make effective treatment more widely available for people who are trying to stop smoking. We could do much more in that area, and again, that's a priority for research.